The virtual learning session will begin promptly at 2 p.m. Eastern Time. The virtual learning session will begin promptly at 2 p.m. Eastern Time. The virtual learning session will begin promptly at 2 p.m. Eastern Time. The virtual learning session will begin promptly at 2 p.m. Eastern Time. Greetings. Saludos, everyone. On behalf of the National Behavioral Health Association and the National Hispanic and Latino Prevention Technology Transfer Center, we welcome you to our virtual learning session titled The Why, What, and How on Prevention Certification and the Importance to increase the Hispanic and Latino prevention workforce in USA. My name is Michelle Zelaya. I'm the project coordinator for the National Hispanic and Latino Prevention Technology Transfer Center. I will be your host for today's session. Before I introduce you to the presenters, here are some brief instructions about today's presentation. This session will be recorded and archived for future playback. It will be closed captioned in Spanish and eventually in Portuguese. The lines will be muted throughout the presentation. When we get to the QA portion of our session, you will have an opportunity to ask questions by typing your question into the QA box, and I will present your question to our speakers. Although for this specific session, we are not providing continuing education credit, but we plan to do for future events. For this virtual, we can provide you with an electronic certificate of attendance with 1.4 hour credit upon request when you complete the evaluation. So let's begin. Next slide, please. The National Hispanic and Latino Prevention Technology Transfer Center is housed at the National Latino Behavioral Health Association, NALBA. NALBA is a nonprofit organization. NALBA was established to fill a need for a unified national voice for Latino populations in the behavioral health arena and to bring attention to the great disparities that exist in areas of access, utilization, practice-based research, and effectively trained personnel. The National Hispanic and Latino Prevention Technology Transfer Center is part of the PTTC network, which is an international, multidisciplinary resource for professionals in the prevention field, established in 1993 by the Substance Abuse and Mental Health Services Administration, SANSA. The National Hispanic and Latino Prevention Technology Transfer Center has a focus for Hispanic and national communities and the workforce that provides services to these communities. Next slide, please. The PTTC is staffed by Dr. Pierluigi Mancini, our project director, Priscilla Yamasi, our executive administrative assistant, and myself, Michelle Zelaya, project coordinator. Also, we'll be asking you to fill out a brief evaluation at the end of this webinar. This evaluation survey is important to the work we do and provide us with the opportunity to improve our training efforts and secure funding for continue our work. Please take a moment to complete the evaluation. Next slide, please. Now, please allow me to introduce our wonderful panel. Let's start with Ms. Sandra Codine del Sesto. She is a member of the Board of Directors and the Prevention Committee, co-chair to the International Certification and Reciprocity Consortium, IRC. The international organization that certifies prevention professionals in the behavioral health arena, including prevention. She is a consultant and a master trainer who has provided community and strategic planning, program development, capacity building in all areas of prevention throughout the United States. For 20 years, she worked in the capacity for the U.S. Center for Application of Prevention of Technology, CAP. She was founder and for 30 years the executive director of Initiative of Human Development and statewide multi-center prevention program. She has worked extensively at both at the community and state level, developing strategies, prevention, behavioral health care plans, creating curriculums and programs for at-risk youth and their families. Ms. Sandra also is member of the advisory board for the National Hispanic and Latino Prevention Technology Transfer Center, PTTC, and the New England Prevention Technology Transfer Center. Sandra is a co-author of SAMHSA Substance Abuse Prevention Training Specialist, SAPS, and the Basic and Advanced Prevention Ethics, as well as many other courses and webinars. Sandra received her bachelor degree in psychology from Boston College and her master's degree in counselor education from Rhode Island College. She also completed a certificate program in nonprofit management through Brown University. Sandra, welcome. Thank you for being here this afternoon with us.
Thank you.
Now let me please introduce Ms. Julie Stevens. Julie has been in the addiction field for 34 years, and she is an advanced certified prevention specialist and was a licensed clinical dependence counselor for 20 years. She has served as a director of the prevention for the Texas Commission of Alcohol and Drugs Center, and most recently as executive director of Life Steps Council of Alcohol and Drugs. She is currently chair of the Prevention Specialist Committee of the International Certification and Reciprocity Consortium. Ms. Stevens served at the Texas Certification Board of Addictions and is a chair of the Prevention Subcommittee. She has a bachelor degree in psychology from Baylor University, 50 postgrad hours in clinical and psychology, and a master of prevention science from the University of Oklahoma. In addition, Ms. Stevens is an adjunct professor for the University of Oklahoma College of Liberal Studies. She teaches core courses for Master of Prevention Science degree, including Foundation of Prevention and Prevention across the lifespan. Judy, happy to have you this afternoon with us.
Thank you. Glad to be here.
Now, please allow me to introduce Ms. Gina Juarez. Ms. Gina has been in the substance abuse, use and misuse prevention field for over 16 years and received her advanced certified prevention specialist credential in 2009 after graduating from Texas University in 2003. Ms. Gina worked with Brazos Valley Council on Alcohol and Substance Abuse with the Prevention Resource Center in Region 7. Later, she moved to San Antonio in 2004, where she accepted a position with San Antonio Council of Alcohol and Drugs Awareness. She has been there for 15 years, and she is currently the Senior Director. Gina has the opportunity to work with youth prevention programs, various coalitions, and be part of data collecting process through Region 8. Gina is also a certified trainer of the Substance Abuse Prevention Skill Training SAPS and Ethics and Prevention course. I have been providing training in Texas statewide Science 2011. In the fall of 2017, Gina became part of the San Antonio College Human Service Program team as a teacher teaching the substance abuse prevention during the fall and spring semesters. So Gina, thank you so much for accepting our invitation, and we're very happy to have you this afternoon with us.
Hello, everyone, and thank you. Very happy to be here. Thank you.
And last but not least, we have our wonderful moderator, Ms. Yvette Torres. Yvette Torres is the former Associate Director for Consumer Affairs at USA Substance Abuse and Mental Health Service Administration, SANSA, Center for Substance Abuse Treatment, CSAC. With her 20 years of career, Ms. Torres has led the team responsible for development of public health, educational and marketing efforts, including the role for the coordination of the National Recovery Month observance held each September nationwide, and was the executive producer and host of the Road to Recovery TV and radio series. Prior to her federal service, Ms. Torres was the Director of Communication at Consumer Union, publisher of Consumer Report magazine, where she integrated the roles of 4 departments: information services, Office of Public Information, radio and special programs, and Consumer Report television. So we are very happy, Yvette, to have you this afternoon and help us to lead this conversation. Now, ladies, welcome again. It's an honor to have each of you in this virtual session. Yvette, let's start this conversation.
Delighted. Thank you, Dolka, very, very much. As Dolka mentioned, today we're going to talk to you about the why, what, and how of prevention certification and the importance of increasing the Hispanic and Latino prevention workforce in the United States. Today we're going to divide up this video learning community session in 3 sections. The first section is really going to talk about what is the prevention certification process and why it's important for the Hispanic Latino community that work in prevention to be certified. Then we're going to move on to the nitty-gritty really of what entails it. Where do you get the certification? What is it all about? And we're going to finish up in the last and third section talking about what are the requirements or the importance, quite frankly, of getting Latino individuals not only to come into the prevention field, but those that are in the field to get certified. So let's start first with the prevention certification process. And my first question is to you, Sandra. What is prevention certification and what are its benefits for the Latino practitioners in the prevention field? Sandra? Julie, you want to take that while Sandra fixes her computer?
She's muted, I guess. The benefits of certification for the Hispanics. First of all, a prevention specialist who is certified has demonstrated competency in delivering effective, evidence-based strategies that produce the outcomes that we are looking for, that are desired. It's about protection of the public and ensuring that services are effective. And so a competent professional can do that because they have been through an examination process, through education, and through supervision to demonstrate that they have learned and are competent in the field.
Very good. Gina, let me go to you. You've been certified. You're a Latina.
Okay.
Why did you get certified?
I got certified because as I started in the prevention field, it started to become more sophisticated. We started to do the strategic prevention framework, and we wanted to show communities that we are professionals in the field. And so having that credential, again, not only makes you more credible, but it also shows that in this field, which is based on science and it's evidence-based, that it's a profession. And so that's all the reason to get that credential.
Excellent. Sandra, are you back on? Can you hear me? Victor, can you please contact Sandra so we can get her back on? But now I'll continue with Julie.
Okay.
Julie, Sandra?
Oh, there she is.
All right, can you hear me now?
I can hear you, Sandra. And
Hallelujah.
wonderful. Welcome. Let me go to a question for you, Sandra. Now, who issues the prevention certification to prevention specialists, Sandra?
Oh, actually, the individual boards issue the prevention certification for each person. So that's a board or a jurisdiction. Later on in this webinar, you'll see a link to the member board so you can find the board in your state. So we have 73 board members in 11 international and 48 states and territories. And prevention certification is in nearly all of those, as well as branches of the military and tribal groups. So yes, we have 56 boards who offer the prevention credential. So that would be the vehicle.
Thank you, Sandra. So Julie, so how do I find this board in each state? What do I need to do, Julie?
Well, we have the ICNRC, which is the International Certification and Reciprocity Consortium, has a website. It's internationalcredentialing.org, and I think we have a slide. There we go. And on that website, there is a link, and this is the link you would want to go to. So go to the member boards link and click on that, and then you can type in the jurisdiction that you're looking for. It will take you to a page that has all the information about that board, and it will have information about the link to the board, about the email address to the board, and also about which credentials that jurisdiction offers. Because besides the prevention credential, ICNRC offers 6 or 7 more addiction credentials, and so that's where you would go.
Excellent. And are there differences in how states manage the certification process? And
yes,
how can specifically Hispanic Latinos navigate these differences?
Well, you know, they would need to go to the link that where the board for their jurisdiction is. Now, we have basic minimum standards for the credential, but jurisdictions may increase those requirements if they desire. And so, for example, in Texas, where I am, our reciprocal certified prevention specialist requirement is just the minimum that the ICNRC requires, but we have an additional one, which is called the advanced one, which requires more education and more experience.
Okay, and we're going to get into those during our next panel. You're going to be more specific and let everyone know how each may vary. Gina, let me go to you. When you were looking to become certified, did you find the process difficult? And if so, I want you to share your experience so that other Latinos that are listening and are part of the panel today, part of the audience today, can get a sense of what they can expect.
Okay, so I got my credential in 2009, so it's been a little while, but it does take some digging to look for information and to look for testing prep. I think that's one thing we need more of is testing prep. But I think, it's important for supervisors to encourage prevention specialists to go for that credential. Like I said, the more credentialized professionals we have in the state, the better. And when we have that credential and we go into communities, in San Antonio, 70% of our population is Hispanic. So, the more that they see us and look like our community, the more trust and the more easier it is to get into the community.
Very good. Thank you, Gina.
You're welcome.
Sandra, let me go to you and ask you, I know that you're going to be talking about the reciprocity of the certification, that it you can move from one state to the next once you're certified. But if I was certified in one state, how do I go about to get recognized in another state, Sandra?
Well, you would contact first the administrator of that board. What we mean by reciprocity essentially is that once you take the national exam and pass it, if there's another board that's reciprocal, and as you saw, we have 56 boards that are, you don't have to take that exam again for the reciprocal certification if you're looking for the actual CPS. So you would contact them. The individual board in another state or jurisdiction might have additional requirements, and the person would have to check on that to see if they needed to fulfill requirements beyond the minimum or beyond what was offered or required in the state they're leaving. But frequently, there's nothing, it just moves over from one state to another.
Very good. Julie, you started talking about what those requirements were earlier. Do you want to go briefly into what each individual that is going to pursue certification, what some of the minimal requirements that some of the states may require?
Yes, and we have a slide on that. I think it's slide 15. But the standards that ICNRC has set are 2,000 hours of prevention work experience, which is 1 year. And so this is the very minimum entry-level person. 120 hours of training and education. Now, there are 6 domains, and so you'll have to have 24 hours of alcohol, drug specific, because we want to know what you're trying to prevent and what the issues are, and then 6 hours specific to prevention ethics. Not counselor ethics, not treatment ethics, not business ethics. It must be prevention ethics because we have our own code of ethics. Supervision, 120 hours, 10 hours in each domain of the 6 domains we'll talk about in just a second. And then passing the ICNRC exam, and then signing a code of ethics. ICNRC requires recertification every 2 years, and we want 40 hours of CEUs every 2 years for recertification because things change, things are updated, we have things happening, for example, social media, so we need to keep up with the field.
Very good. Gina, that sounds like a lot.
It is a lot.
What would you say to a Latino practitioner who's listening now? And I'm adding up here, 2,000 hours of prevention work experience, 120 hours of training education across domains, meaning I have to know about alcohol, substance use disorder, I have to know about drug substance use disorder, etc. I have to know about the terminology. I have to know about the prevention specific terminology. Talk to us about your own experience.
If I can give anybody advice, I would tell them to be intentional in the type of education they receive, the CEUs, because as you can see, there are different domains and a certain amount of hours we have to get in those domains. So when we go to workshops, we go to community events, or where their CEUs are being given, to be intentional in trying to get what you need for the credential you're applying for.
Very good. And to really look for conferences that can help them meet the requirements for this, correct, Sandra?
Absolutely. There's a variety of ways that people can get that education. It's not necessarily face-to-face courses. It can be online courses. It can be conferences, webinars like this one, that on the ones that are being offered by this PTTC. So, and you can have someone, the administrator of your board will be very helpful in suggesting to you options of the kinds of trainings that you can expect to find. In addition, for some of you, you may be trainers yourself, and at least in my jurisdiction, I can count hours of training that I do in addition to trainings that I receive. So it roughly amounts to, if you take 120 hours, it's 20 days of training over the course of several years that you would be requiring yourself to do.
Very good, thank you. Julie, what materials does the ICRC examination for prevention specialists cover? And why do potential certificates have that knowledge?
We have a list of references that we utilize to write questions from the exam. So that's my first recommendation. ICNRC on our website offers a link to what's called the Prevention Specialist Candidate Guide. So it's the Prevention Candidate Guide. In that, it explains how the exam is created, and it also has a list of all of the references that we write questions out of. So that's the first thing I would do, is look at those references. Most of them are free. They're downloadable. A lot of them are from CADCA, the Community Anti-Drug Coalitions of America. And so I highly recommend that you download those, and that's what I would study. So that's a study guide. We also have access to a wonderful study guide that Rhode Island developed, the Rhode Island Study Guide, and we have a link to that as well.
Sandra, I see you raising your hand. Do you want to add something?
No, I'm just validating that. The study guide from Rhode Island actually has a sample test. And in the sample test, it has not only the correct answer, but the reason for the correct answer. So I always tell people when they're preparing to look for the best answer, because some of them are close, but you're looking for the best answer. And the study guide from Rhode Island helps you to think that through.
Gina, you went for the thousands of hours. You did this, you did that, you did the other. How did you get ready for this exam?
I did a lot of studying. As Julie had mentioned, there were some free resources that were available. Now, when I took the test has changed. So people who are going to take the test need to look for the most recent up-to-date material, because it has changed. But and we did a group study with the people here at my agency to encourage each other to take the test. And it's just I think some people just have test anxiety also, and we have to just face our fears and move forward, because sometimes that's all that's standing in the way of someone who is qualified for this certification, is that exam. So it's very doable.
Thank you. Let me ask this of all three of you. Can you each give, from your own personal experience, what domains and knowledge skill sets are highly important to understand before even taking the exam? What should Hispanic Latino audiences be aware of? And I'll start with you, Julie. I'll go to Gina and then Sandra.
Okay, if we could go to slide 10, it will show the domains. We have, when we develop the exam, we utilize a testing company and we do surveys, and this is what has come up from what prevention specialists have said. Number one, what they do, critical is it? And number three, how often do they do it? And so the domains include planning and evaluation, and obviously 30%. So that's the most critical. area to study. And then the other ones, prevention, education, service delivery, community organizing, professional growth and responsibility. Now, communication is a new domain that came up in 2012, 2013, and that's because what changed field is social media. So we need to understand social media, presentations, facilitating groups and coalitions and that kind of thing, and then public policy and environmental change. So these are the topics that you would study. We have references and resources for each of these topics on the reference list that I talked about earlier.
Very good. Sandra, do you want to add anything?
Only that in the planning and evaluation, you see that's 30%. And those of you who are familiar with SAMHSA's strategic prevention framework, that's really talking about the strategic planning process. So we have international boards that are certified in prevention, so we don't use SAMHSA language. We talk about it as the strategic planning process, but that's essentially what we call the SPIF, you know, here in the States. And so if you're very familiar and, you know, and can move around the SPIF process, you'll see in the job analysis, which we really haven't talked about, the job analysis outlines the
well, let's
knowledge.
do it now. Shall we go to the slide, Dolga, and let's talk about that now?
Okay.
Which slide? I'm sorry, can you repeat that?
Yeah, this is good.
Okay.
Sandra, you want to talk?
Okay. I can talk about the written exam. All right. So once you have submitted your portfolio that documents the fact that you've taken the required number of contact hours and you've had the supervision that you need, then you would qualify for taking the exam, which is computer-based in every one of our states and jurisdictions. It's 150 multiple choice questions. It has a 4-option format, which means 4 possible answers, but only 125 of these questions are scored. It says more to come on this, but I'll say it now. The other 25 are questions that we're testing to see if they're reliable and valid. You have 3 hours to take that exam. Most people don't need 3 hours, but it is in English only, so if you need to take the time with that, you can. They're on an on-demand basis. There are over 300 sites. Your individual certification boards will identify the sites in your area. If you're on the border of your state and want to take the exam in another state, you can do that. So it's whatever's closest for you. And you immediately find out the results of your test taking, and then you get an official notification later. And you will get an identification of where you did well or poorly on the exam according to the domain. So if you have to retake the test, you will know where you should focus your study.
Very good. Go ahead.
One more question. We try to do everything we can to support the test taker so that you can pass. We want qualified people in the field, and we're going to do all we can to support them.
Well, what does that mean, we try to support? What does that entail?
Well, it entails providing sample tests in addition to the one that is on the website. So folks can also pay $49 for a computer-based sample test that they can take in the comfort of their own home or office. We have the listing of resources that Julie mentioned. Again, if you fail the exam, you'll see exactly where you were strong and where you were weak, so you can beef up your studies for the next time you take the exam. And you can take the exam more than once. There's no problem with that. There's no stigma attached to that.
That's very good. Is there a limit to how many times you can take the exam to try, and other than financial, each time a person doesn't pass the exam, do they have to pay again to take the exam?
Yes, they do. They have to pay to retake the exam. Some jurisdictions also make you wait 3 months, 90 days to retake the exam, which is pretty standard in the field of testing anyway. And if English is a second language, we have found in Texas that those test takers do take much longer. So they would probably take the full 3 hours for the exam with people who with English as a second language. The other thing,
Gina, talk to me about your experience when you first took the exam.
Oh my gosh, I had the test anxiety, and you know what? I'm not ashamed to say I didn't pass the first time. I didn't pass, and so I got my scores back, and I took that as, you know, as a challenge to myself to see where my weaknesses were. Sometimes we get caught thinking we only work this one part of prevention when there's several different sectors, so it's important to keep that in mind. But no, I took the test again, and I passed the second time. So if I can do it, anybody can do it for sure.
So I see that we put up the slide, Julie, of barriers of certification, and of course we were talking about cost. How much does it cost to take the test?
That depends on your jurisdiction. There is a cost for ICNRC that is passed to the jurisdiction. The jurisdiction can add administrative fees to that. So I don't know, 125 or something in that area to take the exam, but it does depend on your state board.
So it can fluctuate from what fee to what fee? From 125 to what?
I can't say. I don't know, because 125 is, I think, is what Texas charges. But there's also other fees like application fees. So that's, you know, that's kind of hard to nail down.
Are there any scholarship opportunities available so that Latino, Hispanic individuals can take advantage of them?
That's a question for Dolka or maybe somebody else.
Okay. I thought that there might be, I had heard that there might be some scholarship opportunities, but I think people can ask their board, perhaps when they go inquire about the test, they can ask the boards about.
Well, let me just say this. In Texas, because certification is a requirement for program developers, program specialists, the agency most often pays the exam fees and the application fees. So the agency usually does the first time.
Mm-hmm.
So if you
when you're
don't
talking
pass it,
about, Julie, a state agency, which
no, I'm talking about an employer. So
employer.
By an alcohol and drug council, and they receive a grant from the state for prevention services. Usually some of that money can go for training and also testing and application fees. My agency did. When I was an executive director, I paid whenever anybody was ready to take the exam and get certified. My agency paid for that.
Very good. I want to ask a question. I want to go back to something Gina mentioned here. Gina mentioned that she took the test quite a long time ago. Does someone who take the test a long time ago and the certification process includes new material, will someone have to retake that certification because the test has been updated?
No. Once you pass the exam, you do not have to retake the exam.
Okay. And do individuals have to maintain a minimal level of credits or training with their certification?
Yes, you must be recertified every 2 years, and so you must have 40 hours contact hours, continuing education hours every 2 years to recertify. That's a minimum standard set by ICNRC.
And Gina, is that what you've been doing every year? Is that difficult? Have you found it difficult?
Well, it's not necessarily difficult, but just being intentional on getting those hours. There's a lot of trainings that offer CEU. So as Julie had mentioned, we do have to recertify every 2 years, but our organization has incentives for those who do get credentialed. So APS, Associate Prevention Specialist, is the credential that doesn't require an exam. But if an employer goes for that CPS, and there's additional incentives that come with it, including a salary increase. So I really encourage organizations to encourage their staff.
So I'm going to be very, very play devil's advocate here a little bit. I am a Latino practitioner. I'm in the community. I see this daunting requirement. Should I look for a mentor or someone, you know, that has been certified to help me along, Gina?
Oh, absolutely. Mentor can be your guide, because when I came into this field, I was kind of, you know, just kind of, what's the word, like thrown in the deep end, right? Trying to figure stuff out myself. So having somebody provide that guidance makes it more easier for somebody to get certified, and to be able to, you know, encouragement to trainings, encouragement to do extra education, because there's so much literature out there for testing and from SAMHSA. So just having that guidance is really beneficial.
Does ICRC offer mentors, Julie or Sandra?
Not formally, no. It's usually going to happen through the individual boards, that there would be folks who are mentors. That doesn't mean, though, that if people contacted us, we couldn't direct them to some folks in their own states that could mentor them. And I'd like to add, too, that many states, including my own, and I know Julie, offers a preparing for certification mini course that walks through people with through a lot of the information that we're actually giving here today, and it spends a little time talking about test anxiety, going through a small sample test. The goal actually just having people familiar with the process and to reduce their own test anxiety by understanding exactly what they're walking into.
And because there is a supervision requirement, so you must have 120 hours of supervision or practicum, then that person, whoever is your supervisor, ideally is a senior certified prevention specialist and should be able to provide, mentoring along the way as well. Like
supervision isn't necessarily that I need to supervise, but that I need to be supervised in my practice, in my prevention practice, Gina?
Right.
Yes, that's correct. Mm-hmm.
And who did you have, Gina? Who did you go to, and how did you approach someone to help you?
Well, at the time, Abigail Moore, who was our CEO, she was my direct supervisor. So she was very helpful. She had been in the field before I came into the field, and she encouraged me, especially as Latinas. We got to be out there, kind of leading the way, and being out there. And again, advocating for our field, showing that it is a credentialed field. So she was great.
And Julie, what are the most difficult aspects of the experience that both Julie and Sandra, what are the difficult aspects that you have found being all these years that you want to point to Hispanic Latino potential individuals that want to get certified, sort of do's and don'ts?
Well, for me, what we have found is that it depends on, you have 2,000 hours of experience, but it depends on what that experience is.
Okay.
If it is providing a life skills curriculum in a classroom, if that's what you do, then you're going to be strong in certain domains on planning and evaluation and prevention education and service delivery. But your weaknesses are going to be in community organizing and public policy and environmental change. And so your challenge will be the questions on the exam that cover that topic. And so your challenge will be to study those materials which are available to you on the topics where you perceive as your weaknesses, because it's not what you do day to day. If you're a community organizer, then you understand public policy, you understand communication, you understand community organizing, but your weaknesses might be in education and service delivery. Maybe the SPIF is something you're weak in, or the strategic planning.
And what is the SPIF, so that those that don't understand acronyms can understand?
Right, the SPIF is something that Sandra mentioned. It's a strategic prevention framework, but since we do not use United States centric acronyms, it's a standard.
I would just echo what Julie said. That's been my experience when people come to me and they failed. It's because they've been working in one small area of prevention. And I would actually echo what Gina said about being intentional about the coursework, so that you're taking coursework across the domains, particularly in the areas that you may not be as familiar as others. And that will help you be as fully prepared as you can be. And then actually I found mentors myself who could help me in those areas that I needed a little bit more information about, say, alcohol and other drug information, so that they could guide me to some places, things that I could read that would prepare me.
Very good. Gina, when I hear policy and environmental, issues, I mean, if I'm trying to stop somebody from engaging in experimentation with marijuana or alcohol, talk to me about how you gain your experience in that area and what it is, so that our audience can better understand.
So with the policy domain, that has a lot to do with our coalition because of the environmental-based strategies that they work with. So although it may be hard to find a coalition in the area, there's a lot of information, as Julie had mentioned, on CADCA, the oh my gosh, Community Anti-Drug Coalitions of America, and also with SAMHSA. So, and also just kind of like doing your research, finding out what, doing more like information through the PTCs, loads of information through there. But to not be intimidated by those domains, everything that we do falls within one of them. And it's just, doing a little homework to find out where it falls.
What did you specifically do in that policy and environmental area?
What did I do? I'm sorry, can you repeat the question?
What activities did you undertake that covered you in that area?
Yeah, so we're fortunate enough to have a coalition with our organization. So it was attending the meetings. We were working on a evidence-based strategy, the social host ordinance. So we did a lot of trainings, and then working with our municipal government. So all these types of things fall within that domain. And I wouldn't have known that had I not, spoken with people. So again, asking questions, asking why, where does it fall, is how I was able to find out where it goes.
And Sandra, those coalitions, let's talk about, for folks that may not have had experience or have not had experience in this area, who are they comprised of? What are coalitions comprised of?
Well, coalitions are regional, or in most all of our states. They focus on advocacy and prevention. They're composed of people from at least 12 sectors of the community, from business to treatment, education, enforcement, providers, consumers. And those coalitions are typically working on policy change in communities and advocacy around policy change. And we really had looked to the success we've had with tobacco and what really, moved the needle on tobacco use in our states, and have found that kind of work is exactly what does that. So it's been successful around binge drinking. And so most states are continuing with that particular set of strategies.
And so this augurs for also, does it matter what population I'm working with, whether it's the very young or the children, or whether it's 12 to 18? Does it matter who I work with?
Well, no, it doesn't matter. You're using the same planning process regardless of the population. Hopefully, you're including members of the focus population in your planning. Nothing about us without us is the language from the recovery community that's so important. Mm-hmm. So it doesn't matter except to say, and this is important, that your work is, of course, developmentally appropriate. So what would work, you know, with an adult population may not work with a youth population. What works with boys may not work as well with girls. So we have to be very deliberate and thoughtful about what we do. But if people participate in the planning.
We lost you, Sandra.
She was muted by the host. There. She's back.
Okay. If people are deliberate and thoughtful in the planning process, all these things will come to light.
Okay, terrific. Okay, I'm going to give each one of you anything else that we should point to in terms of the requirements that we haven't covered. Julie, I'm going to start with you.
Well, I just think the big picture, what we're looking at for credentialing is ensuring competency in our prevention specialists. I'm just thrilled that you're holding this today because I think there's a target population that we're missing.
Well, we're going to talk about them in the next 10 minutes. So.
Okay. So being sure that you know, the two things we look at is protection of the public and ensuring outcome-based, evidence-based strategies. So that's the important thing and the reason that people need to be certified and credentialed.
Thank you. Anything else, Gina, on requirements?
I just wanted to add, I think one of the barriers that we didn't mention was lack of training and lack of availability to CEUs. So I just want to encourage, I'm thankful that there are trainings online, especially through like the PTCs that offer some trainings with CEUs for communities that don't have the opportunity to have trainings in, directly in them. So just being creative and looking for those types of trainings when they may not be available.
Very good. Sandra, anything to add?
No, I don't think so. I think it's been covered. It's just that I would want to encourage folks, don't be afraid. Jump into it. Get some mentors. Get some advice. As people said, you'll do better than you think.
Okay, previous to this particular session, this live session, we had talked about, and now we're moving into looking how we can increase the number of Hispanic and Latino practitioners who are certified. Does anyone have a number in terms of the number of Hispanic Latinos that are currently have approved the certification process?
I don't think we have an international number, but I did ask in the state of Texas, and about 30% of our certified prevention specialists in Texas are Hispanic and Latino. And so that ends up being 290 or something around in that area.
Very good. Gina, in your experience working in the Latino community, are people curious about it? Do they ask you questions?
No, I think there's just a lot of questions about it, especially when in communities, where there's not very rural communities where there's not a lot of training. And so that's another barrier that somebody comes across in getting those hours needed to apply for the certification. So again, having a mentor, talking to communities where those trainings happen, or knowing where those online communities are really important.
And I'm very happy that you mentioned the differences between the metro areas and the rural communities. I think that is something that we should always keep in mind, because the rural sector does have additional challenges, I think, that we need to be very cognizant of. Having said that, Sandra, are we meeting the cultural competency needs of the Hispanic Latino communities? And if not, how can we do so?
I think it's important that individual boards include where there are a significant number of Latino folks receiving services, that those boards include people from the Latino community. Again, nothing about us without us, that we're not making decisions about, what a Latino applicant needs. I think our local boards need to do that. We have DOLCA on our new job analysis, so that it's a small group of people, and DOLCA is there to speak for the Latino community, not just DOLCA, but we were very deliberate about including her in this process so that she could speak to the issues that are important to Latino applicants.
Very good, but beyond, which I think is marvelous that DOLCA is providing that insight, but Julie, beyond that, do you think there's anything that ICRC can do to facilitate the process more for Latino Hispanic members of the prevention community?
Oh, that's a good question. We have looked at having exams in other languages, but it's not cost effective for ICNRC to do that. And so it would just be to facilitate study guides, perhaps to facilitate mentors, to encourage those things of member boards. And then it would be the responsibility of the member boards. For example, I'm the chair of the prevention committee on my board. And so I really try to work with the state to provide training and make training accessible. There are some difficulties with funding.
And what type of training is that might improve cultural competence?
Well, I think that a certified prevention specialist exam prep course, which is something that we do offer here in Texas, would be really helpful, because if test anxiety is an issue, if English as a second language is an issue, those prep courses can assist in actually deconstructing the questions so that the person fully understands what the question is asking and what the answers are in order to facilitate passing the exam.
Gina, you went through the process.
Yes.
What would you do? What would you have liked to have found when you were undergoing and I'm sorry I can't ask Dolka any questions because she went through it as well. But Gina, talk to me. Tell me, without any hesitation, what would have made your process more easier to do in order to get your certification?
I think it falls really with the organization, because I think with organizations, encouraging staff to apply to get that certification, just having a checklist that I can just check off, knowing that I did get my 6 hours ethics, I did get, all the hours needed. And then also knowing, that with that 2,000 hours of experience, what counts? Because even some college courses that you may have taken may count towards those hours. So just having, I work well with checklists. If I can check it off, it helps me see where I'm at. And I just encourage supervisors to have check-ins with their staff who are planning to credential. Where are you at? What are you lacking? How can I help you? And work all together to try and become
very
certified.
Good. Anything to add, Julie?
I think we pretty much covered the whole gamut of the exam. It's just preparation, I would say, is the key. Preparation and understanding and having all of your education. And then test anxiety wise, just be sure that you eat a good meal before you take the exam, breathing exercises, those kinds of things. would help also in helping with the exam. But it's so critical that we have populations served by people that are familiar with the population, the culture. And so I love that you're having this webinar, and I think it's really critical and important.
And for Gina and Sandra, the last question would be, how do we make the prevention field more attractive to Hispanic Latino community?
It's something out of our control, which is, I think that we need to advocate at the state level to pay our prevention providers equivalent to what someone would get in treatment, or someone would get with the same amount of education, for example, in the school system. I think my experience at running an agency is that, you know, I would support my staff that was Latino or Portuguese or Asian, and they would get their certification, and then they would find a job with the Department of Health or a private organization like the Lung Association, where the salary was, you know, much better. So I think this is something beyond our control. However, what I say to folks is there are benefits that aren't financial, giving people flex time, giving people time off to take courses, paying for their courses, paying for their certification, giving significant vacation time, having an atmosphere, a work atmosphere that's warm and welcoming, I think are things that are important to people, and sometimes that helps us, you know, stay in a field or in a job that may not pay as well someplace else.
Final thoughts, Gina.
My final thoughts, encouragement. I know that some jobs out there may not have, oh my gosh, what am I trying to say? Just encouraging staff to test. I mean, that credential is really important. And again, let's, you know, someone can say at an APS, but getting to that CPS can have all those perks that Ms. Sandra had mentioned earlier. So something to consider.
Very good. Thank you. I am now going to turn over this session to Dolka, who is going to manage the Q&A session. Thank you all for having such splendid answers.
Thank you. Thank you so much. I appreciate all the comments and all the education that you are providing to us this afternoon. Now we're going to go to a few questions that we have from the panelists. The first question that I have is from Juliana David. He said, do your organization provide any credit for language skills? And I think this question is for the ICRC. So if the organization provides any credits for language skills?
As far as I know, there is no board that provides any additional credits for language skills. I think individual organizations do, but from a certification perspective, no.
Mm-hmm.
And that would be the same for treatment and recovery as well.
Mm-hmm. Yeah. Perfect, thank you. So we have one question, another question for Virginia. Virginia say, I have a question, how all the trainings has to be to consider amount the hours to get the certification?
Well, that depends on the jurisdiction. That depends on the board. Some jurisdictions will take training as far back as 5 years, if I'm understanding the question correctly, and others will take training as far back as 10 years. So, but for recertification, that would need to be within the 2-year span from that certification to recertification.
Perfect. And now we have a very interesting question from Mercedes Chavez. Mercedes is asking, could you please tell me if the 70 hours training for acupuncture and the certification specialists that I took at Lincoln Hospital will count to certification. Acupuncture desertification.
No, I don't think that 70 hours of acupuncture detox, it would have to be relate specifically to alcohol and drug or to prevention. So unless there was something in the agenda or something that indicated it was tied directly to alcohol and drug prevention or brain information or detoxification or drugs in the family. So I don't think acupuncture would count.
All right, thank you. And now we have a question from Nilda. Nilda is asking, Nilda Paris is asking if this presentation, this is going to be provided in Spanish. And yes, eventually we're going to provide this in Spanish and Portuguese. Mercedes is replying to the question. He said, yes, it was for drugs detox.
Well, I would submit it to the jurisdiction, to the state board, and let them make that determination, because if it's drug detox training, then it may count.
Thank you. Now we have Virginia. Oh, Sandra, please.
I was just going to add that some boards are very strict on what they perceive as prevention training, and others are have a broader interpretation. So again, as Julie said, you would have to submit that description of the course with the number of contact hours to your board, and they would tell you whether or not they would accept it.
Exactly. Okay. So thank you, Sandra. We have one more question from Virginia. She say, do the Midwest training organizing for a social change count for this certification?
Again, I would submit it to my state board, but I would say yes, that this definitely is a topic that would fall under our environmental strategies and policy change domain. So if that, if that's the content of what the training was, then I would say probably yes, but submit it to your board.
Right.
One more question, say, I would like to pursue my certification, but I don't have a person who supervises my work, what I can do.
Okay, so each board describes who is able to be a supervisor. So once again, the ICNRC sets minimum standards, for example, 120 hours of supervision, but it does not define what that is. So once again, the person would have to go to their individual board and ask who could be certified. In my state, for example, when there weren't a lot of folks certified, the task force, if you were a facilitator, the task force chair or executive committee could serve as supervisor, your supervisor in your agency might be able to serve as a supervisor, but if they were primarily in treatment, they would have to indicate they have some prevention background so they can, adequately supervise. But once again, and as Julie and I have said a couple of times, it's very important that you go back to your individual board and they will give you the very specific information around these topics.
Thank you, Sandra. Now we have a comment from Ricardo Torres. Say, not a question, only a comment. Marketing to the health and human service field, community college and churches to push and recruit Latinos to join the field. Thank you, Ricardo, for that suggestion. We have one more question that is from Juliana David. Are you aware of any workforce grants to increase the Latino workforce in USA? I am from New Jersey. Any resources will be helpful. Thank you. And I think I can answer a little bit of that. The National Hispanic and Latino Prevention Technologies Transfer Center have the opportunity to offer a few scholarships to help to support with the prevention certification. So at the end of this presentation, you will see our contact information and more information about this.
I would also add that some of the prevention technology resource centers also offer scholarships for training in New England, for example. Our PTTC and some of our states offer scholarships to our New England school. So again, your certification board would probably have this information, but in addition, if you contact Dolka, she could direct you to the PTTC in your region, and they may have resources that you're unaware of.
Thank you, Sandra. Now we have from Nilda Paris say thank you. I am working as an outreach and I'm doing workshop about patients safely. Also, NAMI basis instruction since 2009, and I have taken series of training on PSTDs and mental disorder. Did these trainings count?
So the question was, do the trainings have a deadline in terms of its, you know, can they be expired? If I take training 2 years ago, will that count?
Yes, because she took, for example, Nilda took the trainings in 2009.
Wow, that's
She wants to know if those training that some of the trainings were from outreach, NAMI basics instructor, and the series for post-traumatic disorder and mental disorders, back in 2009.
Again, she would have to go to her local board to see how far back you can go in order to have a training qualify for a doubt.
How about in Texas? Does Texas have a limit?
Yes, we have a limit of 10 years.
Okay.
And you know, the question that as I read her question, she says she's taking trainings for PTSD and mental disorders. Can these count? And probably some of them can, but I would refer her back to her state board.
Thank you, Sandra. Now we have a comment from Natalie and a question. I think is Natalie. Let me figure out the last name. Natalie is asking about if we are going to provide this session in Spanish or Portuguese. Natalie Powell, yes, we are going to translate this into Spanish and Portuguese. Very soon you will have those materials available in the 3 languages. Well, I think with this part, we close our Q&A part. Thank you so much for helping us to answer all the wonderful questions that we have from the participants. And now, Judy, Sandra, Gina, Yvette, thank you so much for this amazing and important discussion. I think it really helped us to give a challenge, you know, today to extend a call to action to each of the listeners and participants. No matter where you live within your organization, maybe your community coalition, please go and identify a Latino Hispanic individual who works on the prevention field and invite them to become a certified prevention specialist. Can be new or can be a seasonal worker. Together, we can increase the Hispanic and Latino prevention workforce and be prepared to support our communities with all the challenges that we are facing. And also, it's going to be a great opportunity to apply in prevention as a science and using best practices to serve our communities. Also remember that we're going to have the National Hispanic and Latino Prevention Technology Transfer Center. We'll have a few scholarships available to assist with the prevention certification fee. So contact us at any time for more information. Next slide, please. Also, over here you have the information on how to contact us and request or access free training. Next slide, please. And this is a free training opportunity. This is Introduction to Substance Abuse Prevention, Understanding the Basic. This is an online training. It takes 5 hours. After the completion, you will receive a certificate, and it's free. So take it. You have until September the 30th to take it. And after that, I think after September, we're going to be able to provide another round of trainings. Next slide, please. So now, please take a moment to complete our evaluation. Now, we will be redirected to another page to complete the evaluation. We appreciate your participation. Remember, your opinion is very important to us. Please take a moment. Complete it. Thank you so much. Gracias and obrigado.
Someone would like to see the contact information slide again, so if you could move that back up.
Yes, this is the next contact information.
Slide 19.
And also we have the PTC contact information. So you have both of them. If you want to contact the presenter, here is Ms. Sandra Del Sesto and Julie and Gina and Yvette Torres' email address. And maybe we can move to the PTTC prevention contact information. In there. You have our director, Dr. Pierluigi Mancini, myself, and also Priscilla. So feel free to contact us at any time. And thank you so much for participating in this webinar.
And they're asking for the link also again, the training.
Yes, this presentation will be available, so we can email it to all the participants, and you will have access to the PowerPoint presentation.
Excellent.
Well, thank you so much. Have a wonderful afternoon.
Thank you.
Bye-bye.
Thank you.